Have you ever wondered why so many heart attacks happen before sunrise? Not during stress at work, not during exercise, but quietly while someone is asleep. Tonight, before you brush this off, do something simple. Place your hand on your chest. Feel that steady rhythm. That muscle has not stopped once since the day you were born. It has worked through every argument, every illness, every celebration, every silent night. And between 10 p.m. and 6 a.m., especially after 50, it enters the most vulnerable stretch of its entire day. Most people believe sleep is when the body shuts down and repairs itself. That belief is comforting. It is also incomplete. Yes, certain systems rest, but your cardiovascular system does not power off. It becomes more dynamic, more hormonally influenced, and in many cases more unstable. What happens inside your chest overnight is far more active than most people have ever been told. And the 60 to 90 minutes before you fall asleep can either shield your heart during that fragile window or quietly push it toward danger. I'm Dr. Megan Foster. I've spent over 2 decades in surgical practice. I've stood in operating rooms at 2 a.m., responding to heart attacks and strokes that began during sleep. I've spoken with families who said the same thing. They went to bed fine. No warning, no dramatic symptoms, just a silent event unfolding in the dark. Over the years, I've studied the patterns behind these cases. The research is clear. The triggers are consistent, and many of them happen before someone even turns off the light. Tonight, I'm going to walk you through what your heart actually does while you sleep, what changes after 50, and which common nighttime habits quietly increase risk. No fear tactics, no exaggeration, just physiology, clearly explained, so you can make informed decisions starting immediately. Let's begin with what healthy sleep is supposed to look like for your heart. Many imagine the sleeping heart like a car idling in neutral, barely working. That image is wrong. Sleep is not a flat state. It unfolds in cycles, each one bringing a different cardiovascular pattern. In the first stage of deep sleep, your heart rate slows. Blood pressure drops by roughly 10 to 20% compared to daytime levels. Core temperature decreases. This is the true recovery window. The heart finally experiences reduced mechanical load, but about 90 minutes later, you enter REM sleep. This is when dreaming intensifies. Brain activity rises close to waking levels. Heart rate becomes irregular. Blood pressure fluctuates and can spike. Breathing grows shallow. This cycle repeats roughly every 90 minutes, and each REM phase becomes longer as morning approaches. By 5 or 6 a.m., a REM period may last nearly an hour, creating a prolonged stretch of cardiovascular instability. Then comes the early morning cortisol surge. Around 4 a.m., your adrenal glands begin releasing cortisol to prepare you to wake. Cortisol raises blood pressure. It increases heart rate. It activates inflammatory pathways and stimulates clotting factors. Blood becomes more prone to clot formation precisely when pressure is peaking. That is why heart attacks and strokes cluster between 6 and 10 a.m. Your heart climbs a physiological hill every morning. The real question is whether it begins that climb rested and stable or strained from the night before. And to understand why that difference matters so much after 50, we need to talk about what changes quietly inside your arteries as you age. Because after 50, your cardiovascular system is not the same system you had at 30, even if you feel healthy. The changes are gradual, silent, and often underestimated. Your arteries begin losing their elasticity. When you were younger, they expanded and recoiled smoothly with each heartbeat, absorbing pressure like flexible tubing. Over time, those elastic fibers are replaced with stiffer collagen. The vessels behave less like soft hose and more like rigid pipe. And rigid pipe does not absorb force. Every spike in blood pressure now lands harder against the arterial wall. At the same time, the endothelium, the thin inner lining of your arteries, becomes less responsive. In youth, it releases protective chemicals that relax vessels and reduce inflammation. With age, it produces fewer of those protective signals and more inflammatory ones. It repairs itself more slowly. It becomes more vulnerable to injury during pressure surges, especially the kind that happen overnight and early in the morning. Then there is plaque. Most people in their 50s already have some degree of plaque buildup in the coronary arteries, even if they have never had symptoms. Plaque develops quietly over decades. Much of it remains stable, but some plaques are fragile. Under the right conditions, elevated pressure, inflammation, hormonal spikes, or increased clotting tendency, a vulnerable plaque can rupture. When that happens, your body immediately sends clotting factors to seal the tear. The clot forms rapidly. If it blocks the artery completely, blood flow to part of the heart muscle stops. That is a heart attack, not simply plaque. The clot formed in response to rupture. Now, consider what we discussed earlier. Blood pressure peaks in the early morning. Cortisol rises. Clotting factors are activated. Blood is naturally thicker during sleep due to lower fluid intake and hormonal shifts. These conditions overlap precisely in the hours before sunrise. This is not coincidence, it is biology. There is one more concept that matters here. Blood viscosity. Throughout the night, because you are not drinking fluids, and because certain hormones shift fluid distribution in the body, your blood becomes slightly more concentrated. In a healthy, flexible cardiovascular system, this is manageable. But when compounded by dehydration, alcohol, sodium, or untreated sleep disorders, that thickening increases resistance inside already stiffened arteries. The heart must work harder. The risk of clot formation rises. This is the terrain your heart navigates every single night after 50. It is not fragile, but it is less forgiving. That is why the habits before bed matter so much. They do not operate in isolation. They shape the internal conditions your heart faces during its most unstable window. Now we move into the specific habits, starting with number 7. And this one surprises almost everyone because it does not involve food, alcohol, or exercise. It involves something sitting inches from your pillow, sleeping with your phone in the bedroom. Before you dismiss this, let me clarify what this is not about. It is not primarily about electromagnetic radiation. That concern is often overstated. The real issue is hormonal disruption, specifically melatonin. Melatonin is produced by the pineal gland in your brain. Most people know it as the sleep hormone, but it does far more than make you drowsy. Melatonin actively lowers blood pressure. It suppresses cortisol. It reduces inflammatory signaling in the arterial wall. It acts as a powerful antioxidant, protecting vascular cells from oxidative damage that contributes to plaque instability. In other words, melatonin is one of your heart's most important overnight protectors, and it is extremely sensitive to light, particularly blue wavelength light emitted by every modern screen. Here is what research consistently shows. Just 60 to 90 minutes of blue light exposure in the evening can suppress melatonin production for the first 3 to 4 hours of your sleep period. You may fall asleep normally, you may feel rested, but hormonally, your cardiovascular system is entering the night without its full protective shield. That suppression blunts the normal drop in blood pressure. It reduces cortisol control. It weakens antioxidant defense precisely when early night recovery should be strongest. And there is a second mechanism most people never consider. Even when your phone is face down and silent, it creates what sleep researchers call microarousals, tiny subconscious awakenings triggered by notification lights, vibrations, or even anticipation. You may not remember them, but each one briefly spikes cortisol and blood pressure, fragmenting deep sleep. Multiply those spikes across an entire night, and the cumulative load becomes meaningful. And the simplest solution is also the most effective. The phone leaves the bedroom entirely, not face down on the nightstand, not on silent mode within arm's reach, in another room entirely. Because removing it fully is the only way to eliminate both blue light exposure and subconscious sleep fragmentation. If you use your phone as an alarm, replace it with a simple alarm clock. They are inexpensive, reliable, and they do not interfere with your hormones. Equally important is what happens in the hour before sleep. Ending all screen exposure at least 60 minutes before your target bedtime gives melatonin time to rise naturally. During that hour, dim the lights. Read a physical book. Have a calm conversation. Stretch gently. Listen to quiet music. These are not trivial lifestyle suggestions. They create measurable hormonal changes. Blood pressure lowers. Cortisol begins to fall. The cardiovascular system shifts toward recovery mode instead of stimulation. This change costs nothing, yet its effect on overnight protection is real. Now let's move to number 6, and this one challenges a belief many people hold without question. Sleeping in a room that is too warm. Warmth feels comforting. Comfort feels safe. But physiologically, a warm bedroom can interfere with the very processes your heart depends on during sleep. Your core body temperature is programmed to drop at night. That drop is not optional. It is a biological requirement for deep, restorative sleep. As core temperature falls, heart rate slows. Blood pressure decreases. Metabolic demand drops. The cardiovascular system enters its lowest load state of the entire day. But when the room is too warm, your body struggles to release heat. Blood vessels near the skin dilate in an attempt to cool you. Your heart rate remains slightly elevated to support heat redistribution. You may sweat, which means fluid loss, and fluid loss thickens the blood as the night progresses. Sleep architecture also suffers. You spend less time in deep, slow-wave sleep and more time in lighter stages. Deep sleep is where cardiovascular recovery is strongest. When it is shortened, morning blood pressure tends to run higher, and cortisol levels may rise earlier and more sharply. Clinical studies consistently show that warmer sleep environments are associated with elevated nighttime blood pressure, reduced deep sleep duration, and higher morning stress hormone levels. Not extreme heat, simply temperatures that feel cozy. The optimal range for cardiovascular and sleep health falls between 60 and 67 degrees Fahrenheit, or roughly 15 to 19 degrees Celsius. For someone accustomed to warmer rooms, this initially feels cool. Within a week, most people adapt and report deeper sleep, easier waking, and a calmer resting pulse in the morning. One common mistake is compensating with heavy blankets. That defeats the purpose. The body needs to release heat through the skin. Lightweight, breathable bedding allows that process to occur efficiently. Natural fabrics like cotton or bamboo support airflow better than dense synthetic materials. If you share a bed with someone who prefers warmth, this becomes a conversation grounded in physiology, not preference. The temperature of your bedroom directly influences the conditions under which your heart recovers. Now we move to number 5, and this one connects to almost every other risk factor on this list. Going to bed dehydrated. Thirst is a late signal. By the time you feel thirsty, you are already meaningfully dehydrated. After 50, the thirst mechanism becomes less reliable. It signals later and less intensely. Many adults live in a state of mild chronic dehydration without realizing it. That mild deficit matters overnight. When blood plasma volume drops due to inadequate hydration, the concentration of red blood cells and clotting proteins increases. Blood becomes thicker. Thicker blood flows with more resistance through arteries that are already stiffer than they were decades ago. The heart must generate more pressure to circulate it, and clotting potential rises. There is also a kidney response. When fluid levels fall, your kidneys release hormones that promote sodium retention. Sodium retention increases fluid retention, which elevates blood pressure. So dehydration activates two pathways at once: thicker blood and higher pressure. And that combination carries directly into the early morning surge window. When cortisol is already raising blood pressure and activating clotting factors. If your blood is thicker than it should be and your vessels are under higher pressure before sunrise, you are entering the most vulnerable period of the day at a disadvantage. Many people assume that because they drink coffee or tea throughout the day, they are hydrated. Caffeine does contribute fluid, but it also has a mild diuretic effect, prompting the kidneys to excrete more water. 2 or 3 cups of coffee without steady plain water alongside can quietly leave you behind by evening. That mild deficit may not produce dramatic symptoms, but it becomes meaningful overnight. The solution is not large volumes of water right before bed. That disrupts sleep. Instead, think in terms of distributed hydration. A glass in the morning, another mid-morning, water with lunch, water in the early afternoon, steady intake across the day, then a small glass, about 6 to 8 ounces, roughly 60 to 90 minutes before sleep. Early enough to absorb, not so late that it wakes you repeatedly. Your body gives you feedback. If you regularly wake with a dry mouth or feel dehydrated in the morning, your evening hydration is insufficient. Many people who correct this simple pattern notice improved morning clarity and calmer blood pressure within days. Now we move to number 4. And this one deserves careful, honest discussion. Alcohol before bed. For many adults over 50, an evening drink marks transition. It signals the end of responsibility and the beginning of rest. I understand the ritual. This is not a moral judgment. It is physiology. Alcohol is metabolized at roughly 1 standard drink per hour. As the liver processes it, alcohol converts into acetaldehyde, a compound that stimulates the nervous system. Initially, alcohol acts as a sedative. You may fall asleep quickly, but as it clears, typically in the middle of the night, the sedative effect fades and the stimulant rebound begins. This is why many people wake between 2 and 4 a.m. after drinking, alert and restless. It is not random, it is pharmacology. But the cardiovascular story goes deeper. Alcohol dilates blood vessels, temporarily lowering blood pressure. The heart compensates by increasing output. As alcohol clears, vessels constrict and blood pressure rebounds, often rising above baseline. That rebound often occurs during the early morning hours, precisely when your cardiovascular system is already facing hormonal stress. Alcohol also affects electrical stability in the heart. Even moderate intake can provoke irregular rhythms. There is a well-documented phenomenon known as holiday heart syndrome, in which otherwise healthy individuals experience atrial fibrillation after periods of drinking. In people over 50 with underlying arterial changes, this instability carries greater risk. And remember, alcohol is a diuretic. It suppresses the hormone that helps the kidneys retain fluid. More urine production overnight means greater dehydration, thicker blood, and increased clotting potential by morning. Timing matters. Allowing 3 to 4 hours between your last drink and sleep gives your liver time to process most of it, reducing rebound effects and allowing melatonin to function normally. A drink with dinner at 6 and sleep at 10 is physiologically different from a final glass at 9:30 and bed at 10:30. Now we move to number 3, and this one sits at the intersection of metabolism, hormones, and cardiovascular health. Eating a large, heavy meal late in the evening. Your body does not process food the same way at all hours. Digestion, insulin response, and liver function are governed by your circadian rhythm. During the day, your metabolic machinery runs efficiently. At night, that efficiency declines. The same meal handled smoothly at noon demands significantly more metabolic effort at 9 p.m. Blood sugar rises higher and stays elevated longer. Insulin works less effectively, and your liver must manage incoming nutrients at the same time it is preparing for overnight repair. That metabolic strain does not stay isolated in the digestive system. It spills into the cardiovascular system in measurable ways. That metabolic strain does not stay isolated in the digestive system. It spills into the cardiovascular system in measurable ways. When you eat a large meal late at night, blood flow is redirected toward the digestive tract. Heart rate can rise slightly. Blood pressure often increases as the body manages the metabolic load. Inflammatory signaling, which is a normal part of processing food, becomes amplified when digestion happens close to sleep. After 50, insulin sensitivity naturally declines. That means blood sugar levels rise higher and remain elevated longer after meals, especially in the evening. Sustained high blood sugar quietly damages the endothelium, the inner lining of your arteries. That damage accumulates slowly, but overnight spikes accelerate it. When you lie flat shortly after a heavy meal, gravity no longer assists digestion. The stomach must work harder. The risk of acid reflux increases significantly. This matters more than most people realize. The esophagus shares close neurological connections with the heart through the vagus nerve. Acid irritation can stimulate that nerve and trigger irregular heart rhythms. Many people who wake at night with heart pounding or fluttering after a large dinner do not realize the digestive trigger behind it. Sodium compounds the issue. Restaurant meals, takeout, and processed foods often contain 2 to 4 times the sodium a heart-protective dinner should include. Sodium promotes fluid retention. Overnight, that extra fluid increases blood volume and raises blood pressure. The effect carries directly into the early morning cortisol surge. The practical target is straightforward. Finish your largest meal at least 3 hours before sleep. Keep evening meals lighter, emphasizing lean protein, vegetables, moderate complex carbohydrates, and lower sodium content. If your schedule forces later eating, reduce portion size and minimize salt and heavy fats. Those 2 factors exert the greatest overnight cardiovascular impact. Now we enter the top 2 habits. These are different. The previous factors build risk gradually and compound over time. The next 2 can create immediate, measurable instability overnight. And many people are already experiencing their effects without recognizing the cause. If you regularly wake at 3 in the morning with your heart racing, If you experience skipped beats at night, unexplained morning headaches, or night sweats unrelated to room temperature, these are not random signs of aging. They often point to what we are about to discuss. Number 2. Untreated sleep apnea. Of everything on this list, sleep apnea may be the most consequential and most underdiagnosed cardiovascular risk in people over 50. It is a condition in which the muscles of the throat relax during sleep, allowing the airway to partially or completely collapse. Breathing stops briefly, oxygen levels fall. This can occur dozens or even hundreds of times per night. Here is what happens inside your body when oxygen drops. Your brain monitors oxygen continuously. When levels fall below a threshold, it triggers an emergency response. Adrenaline is released. Heart rate accelerates. Blood pressure spikes sharply, sometimes by 40 to 60 millimeters of mercury within seconds. You are effectively experiencing a fight or flight response while lying in bed. The airway reopens. You take a breath. Oxygen normalizes. And then, within a minute or two, it happens again. In moderate sleep apnea, this cycle can repeat 15 to 30 times per hour. In severe cases, it may exceed 60 events per hour. That means your cardiovascular system is subjected to repeated adrenaline surges all night long. The consequences are not subtle. Repeated spikes elevate blood pressure persistently, not only at night, but during the day. They accelerate arterial stiffening. They promote inflammation inside vessel walls. They increase clotting tendency. They deprive the heart muscle itself of oxygen during recovery hours. Untreated sleep apnea is associated with higher rates of stroke, atrial fibrillation, resistant hypertension, and even sudden cardiac death during sleep. And the most concerning part is that many people have no idea they have it. They snore. They wake up a little tired. They assume it is stress, aging, or simply a busy life. A partner may have mentioned loud snoring or pauses in breathing, but it becomes a joke rather than a warning. Years pass. Meanwhile, the cardiovascular strain continues every single night. There is a persistent misconception that sleep apnea only affects people who are significantly overweight. While excess weight increases risk, sleep apnea is fundamentally a structural issue. The shape of your jaw, the position of your tongue, the tone of your throat muscles, and the natural narrowing of the airway that occurs with age all play roles. Lean, athletic individuals develop sleep apnea as well. Body size is one factor, not the definition. Certain warning signs deserve serious attention. Snoring loud enough to be heard through closed doors. A bed partner observing breathing pauses. Waking with a dull headache across the forehead. Frequent nighttime urination without another clear cause. Persistent daytime fatigue despite adequate time in bed. Difficulty concentrating. Unexplained irritability. When these signs cluster together, they form a pattern that should not be ignored. Diagnosis has become far more accessible. Home sleep studies now allow evaluation in your own bed with small wearable monitors. They measure airflow, oxygen levels, heart rate, and breathing effort overnight. Treatment has also improved. Continuous positive airway pressure devices, commonly known as CPAP, are quieter and more comfortable than in the past. When used consistently, they eliminate apnea events, reduce nighttime blood pressure spikes, stabilize heart rhythm, and significantly lower long-term cardiovascular risk. There are alternatives for those who struggle with CPAP. Custom dental appliances can reposition the jaw to keep the airway open. Positional therapy can reduce events in people whose apnea worsens on their back. In selected cases, surgical options may be appropriate. The key is not the method, it is addressing the condition. For many adults over 50, treating sleep apnea may provide greater cardiovascular protection than adding another medication. That is how significant the effect can be. Now we arrive at number 1, the most underestimated overnight cardiovascular risk, and one that requires a more nuanced explanation. Mistimed blood pressure medication and unrecognized nighttime blood pressure patterns. Most people think of blood pressure as a single number taken at a clinic. But blood pressure follows a daily rhythm. During waking hours, it runs higher. During healthy sleep, it should drop by about 10 to 20% compared to daytime levels. This drop is called the dipping pattern. It gives the arteries a period of reduced stress. It allows the heart to work against lower resistance. It reduces mechanical wear on the vessel lining. However, A significant percentage of individuals over 50 do not experience this normal dip. Some are classified as non-dippers, meaning their blood pressure falls less than 10% overnight. Others are reverse dippers, whose pressure actually rises during sleep. These patterns are associated with markedly higher risks of heart attack, stroke, and cardiovascular death. Here is the gap. Standard office readings measure daytime pressure. They reveal nothing about what is happening at 2 or 3 in the morning. A person may show a perfectly acceptable reading during the day while experiencing harmful elevations overnight, unnoticed and untreated. Medication timing plays into this. For decades, blood pressure medications were routinely prescribed for morning use. Emerging research has suggested that for some patients, taking medication at bedtime may better control nighttime pressure and reduce cardiovascular events. The scientific discussion continues, and individual factors matter. This is not an instruction to change your routine independently. It is, however, a reason to have a specific conversation with your physician about nighttime blood pressure behavior. Because what happens while you sleep may be more important than the number recorded during a brief office visit. And to understand why this matters so much, we need to talk about how these risks combine. Because what happens while you sleep may be more important than the number recorded during a brief office visit. And this is where many people misunderstand cardiovascular risk entirely. We tend to evaluate habits individually. One late dinner does not seem dangerous. One evening drink feels harmless. A warm room appears comfortable. A phone on the nightstand feels normal. Even mild snoring is easy to dismiss. When each factor is viewed alone, it rarely feels urgent enough to change. But the cardiovascular system does not experience these habits in isolation. It experiences them simultaneously, layered within the same 6 to 8 hour window. And when multiple moderate stressors converge during the night, their effects do not simply add up. They amplify each other. Imagine a typical evening. Dinner at 8, larger portions than usual, higher sodium than you would use at home, a couple of glasses of wine, maybe a third while watching television, screens glowing until just before bed. The phone placed beside you, the thermostat set a little warmer for comfort, hydration slightly behind from a busy day, and mild, undiagnosed sleep apnea quietly operating in the background. Individually, none of these choices feels extreme. Now picture what unfolds inside the body by 3 in the morning. The sodium from dinner is promoting fluid retention. Blood pressure is elevated. Alcohol has worn off. And the rebound effect is causing vessels to constrict, pushing pressure higher. Dehydration has thickened the blood slightly. Melatonin production was suppressed by evening screen exposure, so the normal overnight blood pressure dip is blunted. The warm room has reduced deep sleep, preventing full cardiovascular recovery. Meanwhile, apnea events are triggering adrenaline surges every few minutes, spiking heart rate and pressure repeatedly. Then, around 4 or 5 a.m., cortisol begins to rise. It increases blood pressure further. It activates clotting factors. It heightens inflammation. Each mechanism is small on its own. Together, they create a stacking effect. Pressure rises, blood thickens, clotting potential increases, inflammation builds. Arterial walls that are stiffer than they were 20 years ago absorb that stress less effectively. If there is a vulnerable plaque present, this is the window in which rupture is most likely. This is what I call the compound night effect. Cardiovascular risk compounds during shared physiological windows. The night is one of the most concentrated of those windows. The early morning surge is the steepest part of the hill your heart climbs each day. And the habits before bed determine whether your heart begins that climb rested or already strained. Now I want to pause here for clarity. The purpose of understanding this is not fear. It is agency. The human cardiovascular system is remarkably responsive to change, even after 50. When people adjust just 1 or 2 of these nighttime variables, measurable improvements occur quickly. Within days, sleep deepens. Within weeks, morning blood pressure readings often trend lower. Within a month, many people notice more stable energy and fewer nighttime awakenings. Your body is not fragile, it is adaptable. But adaptation requires consistent signals. If every night repeats the same stacking pattern, the system adapts in the wrong direction. Blood pressure remains elevated. Arterial stiffness progresses. Inflammatory tone increases. Risk accumulates quietly. If the pattern shifts, the physiology shifts with it. And this brings us to something most people with hypertension have never been told clearly enough: the importance of measuring what actually happens at night. Because without measurement, you are guessing. And guessing is not a strategy when it comes to cardiovascular health. To understand your true overnight profile, there is one tool that changes everything. And it is far more accessible than most people realize. It's called ambulatory blood pressure monitoring. Unlike a single reading taken in a clinic, this device measures your blood pressure automatically every 20 to 30 minutes over a full 4-hour period, including while you sleep. It reveals whether your pressure follows a healthy dipping pattern, remains flat, or rises overnight. Why does this matter so much? Because nighttime blood pressure is one of the strongest predictors of cardiovascular events. Stronger, in many studies, than daytime readings alone. A person can sit calmly in a doctor's office and produce a reassuring number, while their arteries endure sustained pressure every night that no one has ever measured. If ambulatory monitoring is not immediately available, a home blood pressure cuff is still powerful. Automated upper arm devices are affordable and reliable. Taking readings at 2 specific times can reveal important patterns. Once before bed, after sitting quietly for 5 minutes, and once immediately upon waking, before getting out of bed or drinking coffee. Recording these numbers consistently for 2 weeks creates a meaningful snapshot. If your morning readings are consistently higher than your evening readings, particularly when the difference is significant, that pattern deserves discussion. It may signal a non-dipping profile. It may suggest that medication timing or dosage needs adjustment. It may indicate that sleep apnea or another nighttime factor is influencing pressure. This is not about self-diagnosis. It is about informed partnership with your physician. Your overnight blood pressure behavior is part of your cardiovascular story. Ignoring it because it is not routinely measured does not make it less real. Now let's widen the lens again. Everything we've discussed, screens, room temperature, hydration, alcohol timing, meal timing, sleep apnea, blood pressure patterns, connects back to one central principle. The heart's greatest physiological stress occurs in the early morning hours. Between rough 4 a.m. and 10 a.m., blood pressure rises sharply. Cortisol surges. Platelets become stickier. Blood vessels become more reactive. Inflammation peaks. This window exists every day, whether you are aware of it or not. The night before determines the baseline from which your heart begins that climb. If you enter that window dehydrated, inflamed, sleep fragmented, and under elevated pressure, the slope is steeper. If you enter it cooled, hydrated, hormonally balanced, and well-rested, the climb is smoother. That difference may not feel dramatic in a single morning, but multiplied across years, it becomes significant. Let me be clear about something important. None of this demands perfection. Extreme restriction often backfires. Stress itself is a cardiovascular risk factor. The goal is not eliminating comfort. It is shifting patterns. Start with one adjustment. Remove the phone from the bedroom, or cool the room slightly, or move your last drink earlier, or finish dinner sooner, or schedule a sleep study if warning signs are present. Choose the factor that resonates most clearly with your situation. Commit to it for 2 to 3 weeks. Observe your mornings. Notice whether you wake more clear-headed. Notice whether your pulse feels steadier. Notice whether morning blood pressure trends lower. Then layer in the next change. Compounding works in both directions. Just as small stressors amplify risk when stacked, small improvements amplify protection when combined. Your heart does not ask for dramatic gestures. It responds to consistent conditions. And there is one final concept I want you to carry with you, because it reframes everything we've discussed into something practical rather than overwhelming. It is the idea of cardiovascular margin, and understanding it changes how you evaluate everyday choices. Cardiovascular margin is the buffer your heart has between normal function and stress-induced failure. Think of it like a bank account for your arteries. Every late-night meal, alcohol glass, phone notification, or skipped glass of water draws a little from that balance. Some nights the impact is minor. Other nights, especially when multiple habits stack, the withdrawal approaches a critical level. When margin is low, the early morning cortisol surge, the natural spike that primes your body for waking, can tip the balance. Blood pressure rises, platelets thicken, and clotting factors become more active. Arteries that are already stiffer from age or plaque buildup face the maximum mechanical strain precisely when they are least able to absorb it. This is why heart attacks and strokes disproportionately occur in the morning hours. Your heart isn't failing randomly. It is being pushed past its margin, one night at a time, by ordinary habits that seem inconsequential on their own. The critical insight here is that protective habits aren't abstract or optional. They directly restore cardiovascular margin. Removing the phone from your bedroom preserves melatonin, which reduces blood pressure and inflammation. Cooling the room allows your body to achieve deep sleep, letting the heart rest. Hydrating adequately ensures blood isn't unnecessarily thick, reducing clotting risk. Timing meals and alcohol properly prevents spikes in blood pressure and metabolic stress. Treating sleep apnea stops repeated adrenaline surges that otherwise erode your heart's reserve. Adjusting blood pressure medication timing, in consultation with your physician, restores the natural dipping pattern. Each habit restores a piece of margin, and when combined, the effect compounds, creating a protective cushion your cardiovascular system can rely on every night and morning. Here's the key takeaway. You don't have to be perfect. You don't have to overhaul every habit at once. What matters is cumulative, consistent improvement. Even one small, meaningful change maintained for weeks begins to shift your baseline. Your heart's overnight environment improves. Morning blood pressure becomes more stable. Deep sleep consolidates. Cortisol surges hit a heart that is already rested and hydrated rather than one that has been stressed by multiple avoidable factors. Over months, this gradual compounding produces measurable reductions in risk for heart attack, stroke, and other cardiovascular events. It's also worth noting the psychological benefit of understanding and control. Many adults over 50 feel anxious about heart health precisely because they don't know what matters most. They rely on annual checkups or sporadic measurements and assume prevention is out of their hands. That isn't true. Knowledge of the nighttime window and its compounding risks transforms that sense of helplessness into actionable steps. Every choice you make in the 2 hours before bed has a direct physiological consequence on the margin your heart enters the morning with. Understanding that is power. Let's visualize it practically. Imagine the early morning window like a steep climb. If you begin that climb dehydrated, stressed, sleep fragmented, and with blood pressure elevated, every step is riskier. Your arteries, less elastic with age, bear more mechanical strain. If plaque is present, the likelihood of rupture rises. Now imagine entering that climb, rested, cooled, hydrated, with melatonin and other protective hormones active, sleep apnea addressed, and blood pressure dipping appropriately. The same slope now becomes manageable. Risk is not eliminated, but it is dramatically reduced. Margin is restored. This is what makes the nighttime window both so dangerous and so controllable. It's not luck. It's physiology. It's not chance. It's choices. And most importantly, it's reversible. Your heart is resilient, responsive, and capable of recovery even after decades of wear, provided the right conditions are consistently applied. In the next segment, we're going to break down how to combine all these adjustments into a structured nightly routine that maximizes cardiovascular margin, ensures restorative sleep, and prepares the body for the morning cortisol surge. We'll move from theory into actionable, step-by-step practice, making it possible to implement all 7 habits in a way that actually sticks. If you're committed to giving your heart the night it deserves, stay tuned. This is where knowledge becomes transformation. Now that you understand the physiology, it's time to translate that knowledge into action. The goal is a structured nightly routine that maximizes your heart's recovery, restores cardiovascular margin, and prepares your body for the morning cortisol surge. Think of this as a blueprint, not a rigid schedule. Small, consistent improvements compound into measurable benefits over weeks and months. Start with the environment. Your bedroom should be cool, ideally between 60 and 67 degrees Fahrenheit, 15-19 degrees Celsius. This allows your core body temperature to drop, which triggers the deep, restorative stages of sleep. Avoid heavy blankets that trap heat. Instead, use light, breathable fabrics like cotton or bamboo. These allow heat to escape and maintain airflow, helping your heart slow and your blood pressure drop naturally. Next, remove all screens at least 60 minutes before your target bedtime. This includes phones, tablets, computers, and TVs. Blue light suppresses melatonin, the hormone that reduces blood pressure, lowers cortisol, and protects arterial walls. Instead, use this hour to read a physical book, engage in calm conversation, or do gentle stretching. These activities promote a hormonal shift that supports your cardiovascular system entering its protective overnight mode. Hydration is critical. Ensure you maintain steady water intake throughout the day and have a small glass 60-90 minutes before bed. Avoid drinking large amounts right at bedtime to prevent waking for the bathroom. Proper hydration keeps blood viscosity optimal and reduces clotting risk. Meal and alcohol timing also matter. Finish your largest meal at least 3 hours before bed, ideally lighter with lean protein, vegetables, and low sodium. If you drink alcohol, allow at least 3 to 4 hours between your last drink and sleep. This minimizes rebound blood pressure spikes, reduces heart rhythm disturbances, and ensures melatonin functions optimally. Finally, address any underlying conditions, particularly sleep apnea. If you snore, wake with headaches, or feel fatigued despite adequate sleep, a home sleep test or medical evaluation is essential. Treating sleep apnea eliminates repeated adrenaline surges and dramatically reduces long-term cardiovascular risk. When combined, these strategies create a cascading effect, cooling the room, optimizing hydration, controlling light exposure, timing meals and alcohol, and addressing sleep apnea all work together to restore the heart's nighttime margin. One change alone is helpful, but layered adjustments produce exponential protective benefits. Now that we've built a nighttime routine to protect your heart, it's time to address the morning the window when your cardiovascular system faces its greatest natural stress. The early hours, from roughly 4 a.m. to 10 a.m., are when blood pressure rises, platelets become stickier, cortisol surges, and the body becomes primed for action. How you start your morning can either support the protections you built overnight or undo them in minutes. First, resist jumping out of bed immediately. When you rise suddenly, blood pressure spikes, your heart rate accelerates, and the stress on arteries is higher, especially if your nighttime habits weren't optimized. Instead, sit up slowly, take a few deep breaths, and allow your circulation to adjust. This simple pause lowers the initial surge of strain on your heart and helps maintain the margin you restored overnight. Hydration is again critical. Begin your day with a moderate glass of water before coffee or tea. Overnight, your body has lost fluid, and morning hydration thins blood, improves circulation, and reduces clotting risk. Pairing this with light movement, like gentle stretching or a short walk around the house, engages circulation without overtaxing the heart immediately. Next, timing caffeine matters. Coffee or tea can be consumed, but delay it for 20-30 minutes after waking if possible. This allows your body to naturally wake with less hormonal disruption. Avoid large sugary breakfast early in the morning. Blood sugar spikes can amplify morning blood pressure and increase oxidative stress on your arteries, counteracting the protective effects of your nighttime habits. A balanced breakfast, lean protein, whole grains, and healthy fats supports stable blood sugar, hormonal balance, and sustained energy. If you monitor blood pressure at home, take your first reading before moving or consuming anything. Record the value and compare it to your bedtime measurement. Over weeks, you'll begin to see whether your nighttime routine is producing the intended protective effect. Bring these logs to your physician for personalized guidance on medication timing, lifestyle adjustments, or further evaluation. Let's tie everything together. The 7 nighttime habits: removing screens, cooling your room, maintaining hydration, timing meals properly, managing alcohol intake, treating sleep apnea, and monitoring blood pressure create a layered protective effect. When combined with a mindful, structured morning routine, you create a continuous system of cardiovascular protection. It's not about a single perfect habit. It's about consistent, compounding improvements that give your heart the support it needs both while you sleep and when you wake. Start with one habit tonight, maintain it for 2 to 3 weeks, and notice how your mornings change. Gradually add the others. Over months, these small, consistent actions accumulate into measurable reductions in risk, deeper sleep, and higher energy levels. Your heart, which has tirelessly supported you every second of your life, can now rely on you to protect it during the hours it is most vulnerable. If you found this video valuable, subscribe and hit the bell so you don't miss the next part of this series. Leave a comment telling us which habit you're implementing first. Your experience can help others take meaningful steps too. For a full, structured daily framework for heart and brain health after 50, check the longevity guide linked below. Your heart is working for you tonight. Give it the support it deserves. and it will serve you for decades more.